TB of the hip or tuberculosis of the hip, also called as Koch hip or wandering acetabulum. TB or tuberculosis of the hip affects the acetabulum, the synovium, and the head of the femur. Clinical features: the onset is insidious. There is loss of appetite. Stiffness of the hip is seen. Limping. Child complains of night cries, also called as starting pain, due to rubbing of the diseased surfaces. Cold abscess is present around the hip joint, which might burst open to produce discharging sinuses. Physical examination. It is also called as the stiff hip gait because there is no movement at the hip, and this is compensated by the lumbar flexion extension to allow ambulation. Exaggerated lumbar lordosis is seen due to flexion deformity of the hip. It is called as the painful gait or the antalgic gait. Muscle wasting of the gluteus and the thigh muscles are seen. Swelling of the hip or around the hip joint is present due to the presence of cold abscess. Active and passive movements of the hip are limited due to ankylosis of the hip. And if no movement at all, then it is called as bony ankylosis. Head of the femur might be dislocated and felt in the gluteal region. Stages of TB or tuberculosis of the hip are the stage of synovitis, stage of arthritis, and state of erosion. You can remember this as SI. So synovitis, arthritis, and erosion. Let's see the stage of synovitis. The stage of synovitis is also called as the stage of apparent lengthening. The deformity seen here is flexion, abduction, and external rotation of the hip. It is compensated by tilting of the pelvis, and it lasts for a short duration. Stage of arthritis. The stage of arthritis is also called as the stage of apparent shortening. The deformity seen here is flexion, adduction, and internal rotation of the hip. Spasms of the hip muscles are also seen. The third stage is the stage of erosion, which is also called as the stage of true shortening. The deformity seen here is the same as that of stage of arthritis, that is flexion, adduction, and internal rotation. The cartilage is destroyed and the head or the acetabulum is eroded. Investigations of the radiological features include haziness around the hip joint, lytic lesions might be present, decrease in the hip joint space due to destruction of cartilage. The head lies out of the acetabulum. This is called as wandering acetabulum. Or sometimes the acetabulum might be enlarged or deepened with the head shifted medially. It is also called as the pestal and the mota appearance. Treatment. Conservative management includes immobilizing the hip joint using below knee skin traction. For stage 1 and stage 2, that is stage of synovitis and stage of arthritis, use the conservative management. And for stage 3, which is the stage of erosion, surgical management. The surgical management or the operative treatment includes joint debridement, wherein the joint is opened posteriorly, the pus, necrotic tissue, dead cartilage are removed. Second one is girdle stone arthroplasty, wherein the hip is exposed via posterior approach. The head and the neck of the femur are excised. Post-op, bilateral skin traction is used for about 4 weeks. Then we have arthrodesis, corrective osteotomy. This is done in case of bony ankylosis of the hip and total hip replacement.